Good afternoon, everyone. Thanks for joining us for our session today. Welcome to Binghamton University. We'll give it a couple of seconds here for our guests to kind of filter in. We're glad you can join us. It's a beautiful day up here in Binghamton, New York, and we're proud and thrilled to tell you all about our pharmacy program. We'll give it another couple seconds. I see you guests still coming in. So my name is Joe Tisi, and I'm the Associate Director of Undergrad Admissions. I'm also an alum. I was a student way back in the 1980s. I love Binghamton University. I'm thrilled to tell you all about it. So let's just introduce ourselves. Johanna.
Hi, my name is Johanna Brzezinski. I use the pronouns she and her, and I too am in admissions. I'm an admissions counselor in undergraduate admissions and a Bearcat as well. I got my master's in student affairs administration here from Binghamton, and I love being here. So thank you for joining us, and I will pass it on to Rachel.
All right. Hi, everyone. I'm going to start sharing my screen. So my name is Rachel Perry. I'm the Assistant Dean for Enrollment Management and Student Affairs here at the School of Pharmacy. I work with students who are interested in pharmacy kind of at the high school level, college level, and I also work with pharmacy students throughout their time here in the program. I'm joined by a couple of current students in the program, so I'm going to just turn it over to them and let them introduce themselves really quickly. And then at the end of the presentation, I will open it up for Q&A. So if you do have questions of our current students, we'll be able to get those answered for you. So Emma, do you want to start?
Sure. Hi, I'm Emma Draper. I'm currently a first-year student in the pharmacy program. I went to Binghamton for undergrad and I loved it so much, I decided to stay here for pharmacy.
Kat.
I can go next. Okay. My name's Kat Davinci. I'm a third-year student at the Binghamton School of Pharmacy and Pharmaceutical Sciences. I also went to Binghamton undergrad. I did 3 years there. And then again, I'm in my third year here and I got my bachelor's in biology.
Danielle, do you want to introduce yourself? I know your camera's not on yet.
Yeah, I'm Danielle. I am a P1 in the pharmacy program. So it's my first year too with Emma. And I went to Binghamton for undergrad as well because I was interested in pharmacy right out of high school too. So I got my 2 years in the PEEP program.
Awesome. Thank you, three. So this presentation is about you wanting to be a pharmacist. So I'm going to talk a little bit about what pharmacists are doing, what types of jobs you can have as a pharmacist, and then I'll go into talking about the program here at Binghamton specifically. So pharmacy is a unique area in healthcare. I think a lot of times we think of the person at CVS that's counting pills and putting them in bottles. That is really not what pharmacists are doing today. The role of pharmacists has really expanded over the past 10 to 20 years. And a lot of that has to do with the landscape of healthcare in the US. So as I'm sure you all know, prescription drugs are super expensive. So you see that number there. It's hard for us to even fathom how much money that is. But that's how much we're spending on prescription drug costs here in the US annually. And we're also seeing that primary care and outpatient offices, so your regular doctor that you would go to on a regular basis, they are not able to meet the growing demands for primary care services. So when we think of primary care, we think of point of care testing. So things like strep throat testing, rash testing, diabetes testing, people that have high blood pressure or high cholesterol. All of those are things that are treated with prescription medications. So pharmacists are really able to help step in a primary care setting to provide medication expertise and talk to patients about their medications. You can see that access to healthcare is pretty limited across the US. Every state has at least 25% of their patients or people living there that are in medically underserved areas. So that just means that there's not enough healthcare providers to meet demand. And pharmacists are doctoral level trained healthcare professionals that really can help meet the demand and meet with these patients that don't currently have adequate access to healthcare. So this shows the primary care crisis here in the US. So you'll see last year in 2020, there were over 45,000 open vacancies in primary care. So we're really looking at a severe shortage of providers in these areas. Here in the southern tier where Binghamton is located, we are designated as a health professional shortage area, which just means that we don't have enough people to meet the demands of patients. And right now in the US, there's over 300,000 pharmacists that can help fill that deficit. So when you start to think of disease states like high blood pressure or diabetes or high cholesterol, those are all things that get diagnosed by a physician but are treated with medications. And so your primary care doctor might diagnose you with high blood pressure, prescribe you a blood pressure medication and say, I'll see you in 6 months or a year. And how do we know that that drug is actually effective for the patient? How do we know that their blood pressure is under control? How do we know it's not interacting with other drugs that they're taking? And that's where pharmacists can really step in and have the availability to meet with a patient on a monthly basis or a every other week basis to make sure that blood pressure is under control, make sure the drug is working appropriately, making sure there's not any adverse side effects, talking to the patient about their medication so that they know how to take it appropriately. So pharmacists really are equipped to be meeting with patients in that role of a medication expert. So really the goal is to bring pharmacists out from behind the counter and interacting with patients. So even in community or retail pharmacies like CVS or Walgreens, pharmacists are doing a lot more than just counting pills and putting them in bottles. In fact, they're not really doing that. We have pharmacy technicians and robots that do a lot of that. And so pharmacists are really ensuring that all of the medications that a patient is being prescribed are appropriate for that person. They're also really involved in immunization administration, especially now with the COVID-19 pandemic. Pharmacies are a really great resource for immunizing clinics. But 89% of Americans live within 5 miles of a community pharmacy. So when we're talking about access to a healthcare provider, you can go to a pharmacy without an appointment. You can talk to a doctor of pharmacy, get questions answered. And so that really helps improve access. In some states, pharmacists are actually able to prescribe. So there are states where pharmacists are able to prescribe antibiotics or oral contraception. And so when we start to think of patients that might not necessarily have access to a provider, maybe they don't have health insurance, or maybe they don't have adequate transportation, being able to go to the pharmacy and get those medical services is really important for medication adherence. It's important for patient satisfaction. So that's a really important aspect of pharmacy. Pharmacy is also one of the most trusted professions. So you can see in the chart that I have here, pharmacists have a 66% very high or high trusted rating. And you can compare that to our members of Congress, which only have 8% trust rating. So, pharmacists are definitely people that patients trust for their advice. Part of that is you get to see your pharmacist on a pretty consistent basis. You might see them once a month or every other month to pick up your medications. And so pharmacists are able to really build strong relationships with their patients, which helps instill trust in our patients. Pharmacists are also able to save quite a bit of money for every patient with chronic conditions that they're treating. So they're really able to optimize the drug dosage and combinations, which ends up saving us money, but also leading to better patient outcomes. And in 13 states across the US, pharmacists are integrated into the medical home team. So that means they will be doing things like hospice visits. So they might be training family members on providing pain management for end-of-life care. But pharmacists are able to prescribe in some states. And here in the state of New York, pharmacists are able to prescribe if they have a collaborative practice agreement with a physician. So they're able to order blood work or lab work. They're able to prescribe prescribe new medications or change dosages of current medications. So pharmacy is a really rewarding career. Lots of times when I talk to incoming freshmen, they tell me they're interested in healthcare because they love science and they want to work with people. And pharmacy allows you to do that. Pharmacists are able to counsel patients on medications. They serve on the healthcare team, advising other healthcare professionals. So in a lot of settings, physicians who have taken one course, one semester on medications will really be relying heavily on the pharmacist that's on their healthcare team to make dosage recommendations, to make drug recommendations. They're able to provide expertise on composition of drugs, and this includes compounding drugs. So if a patient has an allergy to a non-active ingredient, pharmacists are actually able to make that drug from scratch without that non-active ingredient to help reduce an allergy interaction. Pharmacists are making sure that our drugs are safe and effective. So it's really important that when we're taking a medication, that it's not giving us adverse side effects and that it's doing what it's supposed to do. So pharmacists are doing that when they're involved in drug development or in a hospital pharmacy where they're the ones prepping IV bags. And really, pharmacists are helping to increase access to healthcare. So when patients come into a community pharmacy setting, pharmacists are able to meet with that patient without an appointment, free of charge, which really does help increase the access to a healthcare provider for many people in the US. Pharmacists practice in lots of different places. So I'm sure you're all familiar with CVS, Walgreens, the grocery store pharmacies, but pharmacists are also able to practice in a clinic or doctor's office, so a primary care or internal medicine. They can practice in hospitals, long-term care facilities, so something like a nursing home. They work in pharmaceutical industry, so that's where new drugs are being developed. They can oversee clinical trials, and many times those package inserts that come with medications are written by pharmacists. They can work for the federal government, so you can do things with the CDC or the FDA. There's also the US Public Health Service and the Indian Health Service that works with indigenous populations. Pharmacists are also able to specialize in different areas. So you might be familiar with a medical doctor that's able to specialize in cardiology or infectious disease. And pharmacists are able to specialize in these areas and even become board certified in these areas. So a couple of these include ambulatory care, cardiology, toxicology. A couple that aren't on here would also be pediatric pharmacy, organ transplant pharmacy, veterinary pharmacy. So there's really endless opportunities for you to be able to specialize in an area that is of interest to you. So how do you become a pharmacist? To become a pharmacist, you do have to complete a graduate level Doctor of Pharmacy degree. The program here at Binghamton is the 4-year Doctor of Pharmacy degree. We don't require a bachelor's degree for entry. So this is a little bit unique because typically a graduate program will require a bachelor's degree. And I'll talk to you a little bit about what your options are to come to pharmacy school without a bachelor's degree in a couple of slides. And then to be able to practice, you do have to pass a licensure exam and become licensed in the state that you wish to practice in. So here at Binghamton, we have the Pharmacy Early Acceptance Program, which gives students who are accepted to Binghamton University as a first-year student or a freshman student a guaranteed seat in the Doctor of Pharmacy. So once you receive that acceptance letter to Binghamton, that means you also have a guaranteed seat here in the pharmacy program as long as you maintain a 3.0 cumulative GPA. You can enter pharmacy school after 2, 3, or 4 years as an undergraduate. So some students say, I definitely know I want to go right into pharmacy school. They'll complete their required prerequisite courses in 2 years and start pharmacy school in their 3rd year or their junior year of undergrad. Other students might want to have a more traditional undergraduate experience. You might be a college athlete. You might want to study abroad. You might just want to earn a bachelor's degree. And so you can do that and still have that guaranteed seat to come to pharmacy school. We also have 3+4 pathways. These are accelerated degree programs where you earn a bachelor's degree in biology, chemistry, or biochemistry at the end of your first year of pharmacy school. So you'll spend 3 years as an undergraduate, and your first year of pharmacy school will double count to fulfill bachelor's degree requirements and will also count towards your doctor of pharmacy. So you get a bachelor's degree and the doctor of pharmacy degree in 7 years instead of 8, which is a really nice way to get that degree. So some of the benefits of the early acceptance program: you have a guaranteed seat, which I think is really important. It's nice to know that once you get here, yes, you'll definitely be able to continue on to pharmacy. We also waive the PCAT, which is the Pharmacy College Admission Test. It's the standardized test for pharmacy school. The courses here at Binghamton are rigorous, as I'm sure the students on the panel will be able to tell you in a little bit, and they do a really good job preparing students for pharmacy school. So as long as you've done well in those courses, we're confident that you're able to do well in our pharmacy program, so we don't need you to take that standardized test. You also have a lot of flexibility. You get to choose the path that's best for you. So we know that not every student needs to take exactly the same course every semester. And so PEEP gives you that option to be an undergraduate for 2 years or 3 years or 4 years. So you can kind of figure out what's going to be the best option for you. We also do a lot of individualized advising. So I meet with all incoming PEEP students at their freshman orientation and throughout your time at Binghamton to make sure you're on track to come to pharmacy school, complete prerequisites. We also invite students to special events. So anytime we have guest speakers or events in the School of Pharmacy, our PEEP students get special access. We also help connect students to the Pre-Pharmacy Association or students in the pharmacy program or faculty. So you really get to build those connections early on and feel like you're a part of the pharmacy school, even when you're an undergraduate student. These are the prerequisites. I'm not going to go through all of them, but they do include foundational science, English, some social science courses. I will mention, if you have completed any of these through AP credit or college level courses that you took in high school, those can all be used to fulfill the prerequisites once you get here. So anything that's transferable, you can use to complete a prerequisite course. So once you get to pharmacy school, the tuition and fees is a little bit higher than when you're an undergraduate. If you are a New York State resident, the tuition is $26,450, but we do have guaranteed scholarships for students in the PEEP program. So you will get a scholarship that you'll be able to have all 4 years in pharmacy school, and that will get applied directly to your student account here at Binghamton. So on the bright side, although it is expensive to come to pharmacy school, pharmacy is a really lucrative career. So according to Glassdoor.com, the median base salary for someone who is a pharmacist is a little over $127,000 a year, and that's a really nice starting salary. A pharmacy manager, the median base salary is almost $150,000. So you are looking at a really lucrative career, and you'll see that there are lots of job openings. So between the two positions, there's over 4,500 open positions right now in the US. So you are looking at a really lucrative and stable career once you graduate from pharmacy school. So Binghamton University is a special place to be. We are a newer program, which means that our building facilities are ultra modern. So we have a simulation community pharmacy, a simulation hospital pharmacy. We have a home care setting where we're teaching students telehealth and telepharmacy. We have our own high fidelity mannequins. They can do anything that a human can do. So they have blood pressures, they have pulse oxes, they can talk to you. So those are really great learning tools that you're not going to find in many pharmacy schools. We also have a state-of-the-art compounding lab, as well as a 797 compliant sterile compounding lab, which meets all of the codes and regulations for a hospital to use that. We have lots of high quality faculty. Many of them have previously taught in pharmacy schools or medical schools. Almost all of the faculty in our pharmacy practice department are residency trained. And those are people that are going to be able to provide mentorship for you. We also have a really small class size. We have about 90 students per class, which gives us a 10-to-1 student to faculty ratio. So your faculty members are going to know your name. You're going to be able to build relationships with them. They're going to be able to help guide you and mentor you throughout your time in the pharmacy program. We also provide within the curriculum 3 National American Pharmacists Association certifications. So you'll receive the immunization certificate, the diabetes certificate, and medication therapy management. So these allow you to do all of those services as a pharmacist. And these are things that insurance companies pay pharmacists for. So these are things that will make you stand out as an applicant to residencies or to jobs when you're looking for employment post-pharmacy school. We also use an interprofessional model. So students work on interprofessional teams with medical students, social work students, nurse practitioner students, public health students. So when you graduate from our program, you'll know how to step out and work on that healthcare team with the other healthcare professionals that you'll be interacting with. We're also located on the university's health sciences campus. We're located about 2.5 miles from the main campus. The Decker College of Nursing and Health Sciences is right next door. So that really does help enhance some of those interprofessional education, but it just means that there's more building space here for students to use for studying. There's some dining options here for students as well. And we're also positively impacting the community here in the Binghamton area. We're in the process of opening a free clinic that students will be staffing. So we'll be able to provide free medical services to the community here in the Binghamton region, which provides students a really great opportunity to interact with patients and make a difference in the place that they are a student. So I will open it up now for any questions. You can feel free to put your question in the chat box, or if you're comfortable unmuting, we'd love to hear from you as well. And if you have questions for the students, I'm sure they would be happy to answer those as well.
So Rachel, I don't see any questions posted in the Q&A, but I am very interested, and I know our guests are interested in hearing our students' stories, if they don't mind just kind of sharing that with us.
Yeah, so if either of you want to talk about what your path was to pharmacy or what your experience is at pharmacy school, if you want to share that, that would be great. And I will put my email address in the chat box. If anyone has any questions that they would rather email me, that's perfectly fine to do as well.
It also looks like there's a question in the chat.
Will there be any on-site tours this summer? So I am hoping that we'll be able to do that. What we've been doing now is just offering tours sort of on an individual basis. So if you do want to have a tour of the pharmacy building, please send me an email and I'm happy to help get that set up for you. So if you want to do a self-guided tour, so the pharmacy building is about 2.5 miles from the main campus. So you can go to the main campus and do a self-guided tour. I believe there is an app that you can download that will help you walk around the main campus. And then for the pharmacy school, we would be happy to actually give you a tour. Some of our labs are locked, so we would be able to let you into those. So just let me know when you're planning on being here and we can definitely get that set up for you.
I can mention about my kind of path to pharmacy. I mentioned earlier I'm a P1, so this is my first year in the pharmacy school. Right out of high school, my only thoughts for pharmacy were that I like science and I like math and I like helping people. So pharmacy kind of brought that all together into one. And I came here for the pharmacy school because there was the early acceptance program. So I knew I'd be more guaranteed admission. It felt a lot more comfortable for me to have my set life path already. So I don't have any like crazy moment that made me choose pharmacy, but a lot of people just like the sciences and maths and just end up here.
Yeah, that was also kind of my thoughts. Like I said, I'm a third year student. So I went to Binghamton undergrad. Going into Binghamton undergrad, I didn't know that there was going to be a pharmacy school right away. But I had heard rumors that it was going to happen. And I looked at other pharmacy schools, and I still wasn't set on pharmacy. So I kind of went into undergrad with an open mind. Again, like Danielle, I just like the sciences and math. So that kind of just set me up with the prerequisites that I completed. And then after my second year, that was when the first year of the pharmacy school opened up. And then, like I said, I did a 3+4. So I ended up, my first year of pharmacy school was my fourth year of undergrad as well, which helped me complete my bachelor's in biology. But yeah, like Danielle said, I was just interested in science and math, and I had started working at CVS right before I began to attend the pharmacy school. And I had shadowed pharmacists in high school. But yeah, again, just I knew I wanted to be in the healthcare field. But now I'm definitely happy that I chose pharmacy, looking back.
Kind of like Kat, I went into undergrad not really knowing that I like wanted to do pharmacy. I was really open. I knew I wanted to do something in healthcare, and I know I love people and I like being with people, and science and math are like my favorite things to learn about. So I was super interested in all that, and I knew I wanted to go into healthcare. But then like freshman year, I heard about the early acceptance program, and something that like really like got me like set on pharmacy was Binghamton, because I got to like literally see the school being built from like the ground up from like starting in my freshman year. And it was really cool. And I love the building. I got to see it early since I did do 3 years at Binghamton. I got to see it early and I loved the building. And I worked with Rachel every single like year of undergrad, helping plan my schedule and making sure I was on track. And yeah, now I'm super happy to be here.
Outstanding. These are great stories. I mean, you look at Binghamton and you say, what makes Binghamton special? And I think it's that sense of community. It's a strong community. Academically, Binghamton is amazing. You know, students are brilliant. You can see our students are brilliant, obviously, right? But the reality is this, you know, we really care. We want you to be successful. You know, we hope you learn more about us and want to know more about us, because I think Binghamton is special. You know, we look at our rankings and our accolades, and that's very important. But the academic support that you get and the success that you get coming from Binghamton is critically important. We have one more minute. And can I ask the students, just a quick question, just real fast. What made you choose Binghamton among all the other amazing choices in colleges that you may have had? What do you think? Danielle, can you start it?
Yeah, I can. I chose for like a couple of smaller reasons. One was it had the P program all set up, so I liked that I could go straight from undergrad into the pharmacy school. That was really cool for me. And then the other thing was that it just seemed like there were so many opportunities here. There's so many clubs. The professors all like have research that I could have gone into if I decided I wanted research, which I didn't. But there's like so many different opportunities for growth here, and that's what really made me excited for it, because I'm not someone who wants to just study and that's it. I want to be involved in the community. So
Great answer.
that was my decision.
Very cool. Katrina, what do you think?
So initially my choice of Binghamton, like for undergrad, I live in the Binghamton area. So that was nice for me. And I also knew, again, you mentioned the accolades of Binghamton. It's an amazing school. And I knew I wanted something that would challenge me. But then pharmacy school in particular, again, I knowing the Binghamton like undergrad community, like just the sense of community there, I knew that the pharmacy school would provide the same thing. I just loved the Binghamton community. And then like Danielle mentioned, for pharmacy specifically, there's just so many different opportunities for students. And actually on my like interview day, I know that I felt so welcome already. And even though it was, I thought it was super stressful, as any interview would be, it was as laid back as it could be. And the faculty and students really sold it.
Excellent. Emma, did you want to share?
So Binghamton for me, I do live in state like as well. I think they both live in state too. And I did want to stay in state. I'm from Rochester, and I didn't want to go to like a small school, but I didn't want to go to like a huge school like University of Buffalo. And I thought Binghamton was like the perfect size, and I loved the campus and like the community when I came to like visit the campus and stuff. It was a lot of fun. And I coming here for like tours and stuff, I could like really see myself there.
Yeah, it is a beautiful campus. Rachel, our time is up. Unfortunately, it's a fast half an hour. It really was. Rachel, did you want to say any, or Johanna, any last minute thoughts before we leave?
Just if anyone has any questions or needs anything, please reach out and I'm happy to help you and get you in touch with people if I'm not able to answer your questions.
Yeah, and if you have questions about Binghamton in general, feel free to reach out to Joe and myself or our colleagues, 10 a.m. to 5 p.m. on Zoom or by phone.
Great. Well, thank
Thanks,
you all. We're
everyone.
thrilled that you came. Have a great afternoon. Take care.
Bye.